All right, y'all ready? Are you ready? It's Tuesday, so you know what time it is. It's time for Tip Tuesday. Come on in, come on in. Go ahead and put hashtag replay. Thank you for watching the replay. And if you are here for the very first time, let me know who you are and where you're watching from. I'm Nikedra Brown, the nurse practitioner who teaches and trains you ways to get and stay healthy. And I do this segment every Tuesday about 1:35 called Tip Tuesday to give you some health education and information to help you improve and maintain your life. So I'm waiting for you all to come on in so I can do a check on my props. And y'all let me know if you can see it. As you come on in, don't forget to say hello so I can properly say hi to you in the comments. If you're watching on replay, hashtag replay. If you are hopping in, let me know if you can read my props facing forward. It should say Tip Tuesday with Nikedra, because I love to use these. Of course, I could use the ones that are auto-generated, but I like these. So let me know if you can see this. Should say Tip Tuesday with Nikedra. Say hello as you come on in. I love to see you and greet you as you come in the room. We do this thing on Tuesday called Tip Tuesday. Let's go over the rules. Y'all let me know if you can see this. Our announcements first. The cost of attendance is to share. So make sure you press that share button. Share this out on your news feed. We're going to talk today about minority health and corona. So you want to make sure that we get this out to those around you. Make sure you say hello. I see Miss Fanny saying hello and where you're watching me from, what state you're in. I realize I have viewers from all over the country. So let us know where you're watching from. And if I ask you a question, engage with me in the comments. Put your answers. If you're watching now or if you're watching replay, then let me know if you can see this. And listen and learn. So in all of my teaching, I like to make sure that I give you valuable information and that you listen to it, you learn, and you help to educate others. We're going to talk about somewhat sensitive topic for today, so I want to make sure that you are also respectful. So thank you for letting me know that you can see it. So those are our rules for today. Make sure you share the broadcast out if you haven't already. Make sure you say hello in the news feed. Let me know where you're viewing from, and make sure that you engage in conversation. So how many of you knew that April is National Minority Health Month? How many of you knew that April is National Minority Health Month? Raise your hand if you knew. Say yes or no. Did you know that April is Minority Health Month? It's okay if you didn't. That's why you're here. So why do we have a whole month related to minority health? It's an effort to raise awareness about the health disparities that continue to affect racial and ethnic populations. So this encourages people like me to educate the public, talk about early detection and the control of diseases and the complications. So some of you may be aware, some may not. There are still some healthcare disparities and barriers as it relates to care in health. And so that is what this month helps to address. So tell me, what are some of the diseases and conditions that adversely affect minorities? Again, if you're watching for the first time, there are no right or wrong answers. We have conversation. We all come in here to learn, and I like you to engage. So what are some diseases and conditions that adversely affect minorities? There's also a delay, so I know I have to wait a few minutes. What are some of the diseases and conditions that adversely affect minorities? Y'all know some of them. I know you do. People in your family have them. You may even have them as well. How about high blood pressure or hypertension? How about diabetes? Go ahead and put those in the comments if you know some others. How about high cholesterol? What about heart attack? What about strokes? I see some answers coming in now. Thank you. What about cancers? What about obesity? Increased risk for being overweight. So the theme for this year is actually active and healthy. So that's the theme of National Minority Health Month, is to be active and healthy. So are you being active and are you staying healthy? Are you? Are you being active and are you staying healthy? Since most of us are home with stay-at-home orders, except of course for those who are essential, that would be me. I'm actually sitting at work right now. Staying at home is the focus of this month's initiative, and it's giving you safe ways to get in your community, to be physically active in your home, mentally active, and also emotionally well. So lots of times people need this reminder. Your health includes physical, mental, and emotional. Okay? Because a lot of people think about just physical when I say being active and healthy. People think about just your physical, but you also should consider your mental and your emotional health. So let us know. This is time to shout yourself out. Let us know, what are you doing to stay well during this time? If you're not doing anything, put nothing. If you start an exercise routine, let's hear that. Let's hear about what have you been doing to stay well during this time. Hopefully, you're using this time to reset, to regroup, and make some new normals. But it also may be some self-awareness time right here to recognize that, hey, I'm not doing anything to stay active and to stay healthy. So what are you doing? List some ideas of how one can stay well during this time. During this time that you're staying at home, you're not as active. What are some things that you can do? If you are just hopping on, we're talking about April is National Minority Health Month. And so because it is National Minority Health Month, we're going over just a few of the reasons why it's actually a National Minority Health Month. There's several conditions that minorities actually rank higher in. We're going to go into that whole COVID and minority conversation, but y'all know, got to teach you a little bit first. I see Miss Fanny is exercising and eating healthier. Absolutely. So I ask you to list in the comments, what are you doing? Or what are some things that you can do to stay well during this time? Wellness not only being your physical body, but mental and emotionally. How are you doing to help those things stay healthy as well? So one thing you can do is to set some parameters on your electronics and your social media. So many of you are working from home. Many of you have created new normals, and you find yourself, you're on your social media and your electronics. How ironic, right? Because we're on it right now. But if you aren't usually on social media during the day because of work, then find something else to do. Even though you're at home, make sure that your kids, if you're supposed to be homeschooling them, give them your complete focus. Because one of the things that makes you physically and mentally and emotionally unwell is because we let a lot of things take over our mind and our brain, right? So you want to make sure that you actually focus on those things that you need to focus on at home. Home projects, if you have something at your house that you've been wanting to do for a long time, do that. So make sure that you are spending or setting parameters around your electronics and your social media. If you are just hopping on, we're talking about how April is National Minority Health Month. I'm giving you some ways to make sure you stay healthy in both your body, your mental capacities, and also emotionally. So first we talked about setting some parameters around social media. It's all around us, right? We got Facebook, we got Instagram, we got Twitter. You pick up your phone, it's almost immediately, you're on your email. Everything comes to you right in the palm of your hand. So make sure you're setting some parameters around all of that. You'd be surprised how much time actually passes you by because you are in front of your electronics. So that brings us to our next thing to do. You should set a schedule. So even if you're at home with the stay-at-home orders, you should be at home. Make sure you set a schedule, and you need to stick to it. Those of you with young children who are home, it's important for you to stick to a schedule with them too. Children are creatures of habit, and believe it or not, you are too. So you need to still wake up at a certain time, eat lunch at a certain time, end the time for school if you are homeschooling kids. Make sure you set aside time to work and play, and go to bed on time. Don't just wing it. Don't just say, oh, the kids aren't in school, they can stay up for as long as they want to. No, they can't. No, they can't. And you can't either. You'll find it harder and harder to get back into a routine if you just run amok now. So the second thing is to make sure you stay in a routine. Hey, Nora, thanks for hopping on. So if you are just tuning in, make sure you say hello in the news feed so I can say hi to you. And make sure you're sharing this out. Hashtag replay if you're watching on replay. We're talking about National Minority Health Month. We're going to talk about some minorities and how it relates to Corona. But I was giving you a couple of ways to make sure you stay well in your body and your emotions and mentally during this time. So get up and get moving. I saw one comment that said one of the things you were doing during this time, and Nora is running, going away for a bit. Absolutely. So what are you doing? If you didn't see that in my presentation, what are you doing to help stay physically, mentally, and emotionally fit during this time of change? If you haven't already, this is a great time for you to start a physical activity routine. I see a few people in the news feed have already started one. So this is no more excuses for time, right? Don't even say, oh, I can't go to the gym. I don't have any workout equipment. This is the opportune time to remind you that Club 550 is open. Woohoo! Shout out to the Club 550 ladies. I see y'all. Thank you, thank you. So this is our second week. I'm actually closing registration on Friday. So if you want to be a part of Club 550, get your exercise on, learn the importance of physical activity, and avoid quarantine 15, bit.ly/Club 550. If you're not doing that, what are you doing? Because forever you will say, oh, I know I need to get up and get moving. Oh, I know I should exercise. And when you come out of this quarantine, you'll find yourself 10, 15 pounds heavier. That's what we want to make sure we're avoiding. So make sure that you all are doing something to get up and get moving. Now, is there a correlation between minorities and COVID-19? So I've heard some back and forth about this. You know, initially people were saying that, oh, people of color, black people couldn't get coronavirus. Is there some correlation? Now that you've had time to digest it, you hear the media because you're on your phones and you're listening to the news nonstop. Is there a correlation between minorities and COVID-19? Put a yes, put a no in the comments, or I don't know, or maybe what you think. So when we talk about minorities, we're talking about, in this case, people of color. So is there a correlation? Do you hear some speculation between minorities, COVID-19? What is all that talk about, right? What is all of that talk about? So if there's a correlation, I have like one yes in the comments. Make sure y'all are engaging. That's your cause for attendance. Let's talk about a little bit of why you may think it's a correlation, and I'll let you draw your own conclusion. I like for you all to be informed. You know that. So minorities typically have high rates of underlying conditions, right? So we just talked about, typically you have high rates of high blood pressure, high rates of diabetes, high rates of obesity. Diabetics, for example, 18.7% of all African Americans are diabetic. 7% of all Hispanics, right? We have a 77% higher risk of getting diabetes than white people. So we have higher rates of underlying conditions. So I always tell y'all, treat your body well on the front side, then it will come to bat for you on the back side. So many people say, oh, I'm not sick, or oh, I'm healthy, but you still have to take care of your body before you actually come into contact with illnesses or diseases. So high rates of underlying conditions, food deserts. Who knows what I'm talking about when I say a food desert? Who lives in a food desert? Say me in the comments, because I know where some of you all live. All right, food desert. Do you know what we're talking about when we say food desert? Think about a regular desert. What is that? It's a place where there's practically nothing. Barren, right? So food deserts, there's no grocery stores, typically. Now, oddly enough, people may find it difficult to buy affordable or good quality fresh food. That's the key. Because a food desert might be a place that has plenty of food. The food is plentiful, but it's not fresh, and it's not healthy, and it's not good for you food, right? So there could be places that have plenty of food, but they are still food desert because it's quick food, it's fast food, it's fatty foods, it's not healthy food, good quality food, nutritious food. People without a grocery store, you are in a food desert. So that makes your risk for getting COVID-19, if you get it, it makes you more likely to have some bad side effects because you have some of these risk factors. Limited access to health care. That's self-explanatory. We just don't have enough access to health care, be it in our communities. If you're just hopping on, we are talking about the correlation between minorities and COVID-19. And this is why there are some distinct correlations between the two. One, there are high rates of underlying conditions among minorities. Two, there are lots of food deserts in our communities. Three, we have limited access to care. Four, environmental stressors. Who knows what environmental stressors are? Surely you all know, because we probably all have some of them right now. Some of them are our children are at home with us, they're not going to school, living situations, transportation, finances, you may be in a crime-stricken area. All these tend to cause stress, and so they're environmental stressors. What about racial biases? That's a big one. Racial biases. Racial biases has to do with allocation of health care. So minorities are less likely to get referrals, right? So healthcare typically is stratified on an algorithm. So for those of you who know, algorithms kind of, you follow this certain pattern all the way down. Yes, you follow this side. No, you follow that side. That's typical in healthcare. But studies show that people who self-identify as being black were generally assigned lower scores on these algorithms, and they're equally as sick as white people. So as a result, they get less referrals and they get less access to certain programs that may help to improve their life. So that's what happens when we're using that algorithm. That's why there are racial biases as it relates to healthcare and the algorithms. Systemic racism. There's a difference between racial biases, systemic racism. That's probably a whole lot in and of itself. That affects actually the structure of our society. So it has less to do with violence and it has more to do with policies. How policies are structured to actually systemically cause systemic racism among people. You got it? Limited resources. So in African American communities, minority communities, we have limited resources. So because of those limited resources, be it education, be it money, then that means that if we should get not only COVID-19, let's be real, not only COVID-19, but any major health disease, then it is harder for us to overcome the odds. So let's be clear. COVID-19 can affect anyone. So if you didn't hear my first question, COVID-19 can affect anyone, right? So there's no perfect person or nobody who has the perfect picture to be somebody who's going to get COVID-19. You can't just look at somebody and say, oh, you might get it or oh, you might not get it, because anybody can get it. What we're talking about now is why we are seeing higher rates among our minority populations and why they are more likely to have mortality or die because of COVID-19, because we already have this stuff in place. And if we already have so much of this stuff in place, then our inequalities are going to lead to poor outcomes. Let's just face it. Our inequalities are already going to lead to poor outcomes, but because by the time we get to where we need to get to, then we can't receive the care we should get because we don't fit the picture on the algorithm. And so they send us back home, and then it's just this cycle, ever revolving cycle. So this is really why we're seeing such a correlation between minorities and COVID-19. So the takeaway from this is systems work the way they were designed to work. So people create systems, they create them the way they were designed to work. So if equality and equal health care was a part of the original system, meaning even before COVID-19, before coronavirus, if our system was one built on equality, then it wouldn't be such a case now. So it shouldn't be a surprise to anyone that the results of our current system show that minorities are more likely to have mortality and morbid outcomes as it relates to coronavirus, because that's the makeup of our underlying system. So unless we can change some of these systemic processes, then guess what? The outcome is going to continue to be the same, unfortunately. So at this time, I just want to take a minute just to give my condolences my personal heartfelt thoughts of comfort. I want y'all to drop hearts, worship hands, praying hands for all the families who may have lost loved ones, for those who have loved ones who are currently diagnosed, maybe hospitalized, maybe at home in self-quarantine with COVID-19. It is truly something that is in minority communities, and it's not something that we can easily discredit. We have to make sure we spread the message to have people take care of their bodies before. Make sure you are active in getting the care that you know you need. Make sure you share this on your news feed so that people will understand that you have a right to accessible health care. You have a right to health care. Now, whether or not the health care is extended to you, that's a separate issue, but you do have a right to get health care, and you should make sure that you are given equal health care and that you continue to fight for your space as it relates to your health. All right, so I'll tell you a quick story and then I'm gonna let y'all go. So many of you know my father was sick, and he actually passed away last year, and so he is somebody who was a laborer, worked all of his life, forever, and he actually happened to be working in a factory at the early onset of his illness, and so he never missed work. Like, if he was supposed to be on the schedule, he was going to work. But he missed not one, but he missed 2 days out of work. So on the second day, I was like, I'm coming down there and I'm coming to take you to the ER. So this is going back to the whole conversation that we talked about racial biases and systemic racism. So we get to the ER. All labs come back. Short of the story is all labs come back negative. Chest x-rays negative. Everything they did for him was negative. But I kept saying to them, I know that what you're saying is that everything is negative, but I know a man who doesn't miss days out of work. And now he's missed 2. Out of ever how many years, he's never missed time out of work. And now he's missed 2. And even though your algorithm is telling you to let him go home, that he must be okay, what I'm telling you is that we need to try to figure out what else is going on, because it's not okay. So this type of lobbying, this type of advocacy shouldn't have to be done, but it's real and it happens. And so because of that advocacy on his behalf, he actually did get admitted. But that just goes to show you how we're on this algorithm, and sometimes you have to speak up. Now, you can speak up aggressively without being rude, without being discourteous, but just letting them know that you are concerned and that you care about your loved one. Because in actuality, you did bring your person to the healthcare facility. So do give them the due diligence to do their work. But in this situation, this was not his normal. And so when you know people are just outside their normal, even though that's what your tests are saying, even though that's what everything you're looking at is saying it's normal, it is not his normal. And so when it's not his normal and it's not your healthcare or your loved one's normal and not your normal, then I would advise you just to make sure that you are getting the care you need. So if you are just hopping in, you're going to have to watch me on replay. We talked about April. April is not National Minority Health Month, right? So we went over why minorities and COVID-19 may be running kind of hand in hand. What you may have heard may not actually be correct. So I gave you some reasons why you may be seeing more of a correlation of that in minority communities. And we talked about why you need to make sure to take care of your mind, your body, and your emotions during this time. So I'm going to drop off and see you all next week. Make sure you share the broadcast, and I'll see y'all next time. Bye. Hey, Shamika. See y'all next time. Bye.